Hello, everybody, friends and followers. I am Velvet Spicer, and I am the Communications Manager for the Rochester and Finger Lakes Region Chapter of the Alzheimer's Association. Today's video is the second in a new partnership with Rochester Health Engagement Partners. Led by Cynthia Adele, RHEP is a nonprofit that endeavors to educate and empower the African American community through education and events. The goal of our partnership is to bring information and stories to those who want to learn more about Alzheimer's disease and dementia from the perspective of people of color. We realize that people receive information better from those who look like them and who share some of the same experiences. Data shows that older African Americans are 2 times more likely than older whites to have Alzheimer's, and they are less likely than whites to receive a diagnosis of the condition. They also are less likely to seek support and resources to assist them. So it's our hope that this partnership between nonprofits will help you find the answers that you need and encourage you to get involved in whatever way you can. Today's guest, we're excited to welcome Wade Norwood, CEO of Common Ground Health. A Rochester native, Mr. Norwood has held leadership positions in the community for more than 3 decades, including roles in public service, education, and healthcare. In management at Common Ground Health since 2006, Mr. Norwood has been central to the nonprofit's strategic planning process, pushing the organization to become a more effective change agent for all Finger Lakes region residents, especially those most at risk. He also spearheaded the organization's efforts to engage underserved populations in health improvement, championing the creation of the African American Health Coalition, the Latino Health Coalition, and the Partnership for Access to Healthcare, and providing ongoing support for these and other engagement initiatives. Thank you so much for being with us today, Wade. And Cynthia will take it from here.
Hello, Wade. Thank you so much for joining us today. We know that you are so busy, and we appreciate you giving the time to talk to us and our viewers today.
Thank you for inviting me. It's a real honor and a pleasure to be here.
Okay. So Wade, in your experience with Common Ground Health and beyond, what can you tell us about healthcare disparities in the African American community?
Well, I would start by saying that racial health inequities are real. They exist and they cannot be explained away by income or by education or any of the other things we might seek to avoid confronting the reality that race and racism continue to be alive and well in the year 2022, and that we have a lot of work that we need to do so as to address how interpersonal, internalized, organizational, and structural racism plays out in our society. But Dr. King was right when he said of all the forms of inequity, injustice in health is the most shocking and the most inhuman, because in health, we are literally talking about life and death. And so I think it is very significant, and it's really exciting that in our community, we are talking about the causes and the consequences of health inequity. And those causes have far more to do with things that are not medical. They have to do with housing, with transportation, with economic opportunity. And the consequences are meaningful in that they really shape and limit folks' life course trajectories and families' trajectories. So I'm delighted to be here and to have this conversation about how it is that we might do a better job of approaching and achieving health equity here in the Finger Lakes.
Yes, it's a very necessary conversation. And I know it's one that you've been having for several years, but it's never ending. It's going to be a never ending conversation. So,
Amen.
yes, we know that African Americans and Hispanic Americans have a higher level of Alzheimer's and other dementias. What can you tell us about how medical conditions and socioeconomic conditions may play a role in the higher incidences of dementia among people of color?
That's a great question, and it really reminds us how so much of what we know today about brain science, we've really just learned in the last 15, 20 years. So we are new in this space, but we absolutely do know, as you suggested in your question, that race is a social construct. So we have to start thinking about what is going on in the African American community that leads to this predisposition or this higher level of incidence of Alzheimer's disease and dementia. Clearly, socioeconomics is a part of it. Clearly, we have to be concerned about what are dietary contributors. What are the contributors of having a more sedentary lifestyle? And at the same time, we need to really think about what is the impact of weathering racism in America, and how might the accumulated impact of navigating race in America for African Americans with attendant issues of anxiety, of depression, how might those factors play in? But I think I use this as an opportunity to talk about the cultural factors, which are rooted in socioeconomics. First of all, we really have to do a better job of building relationship between the African American community and the physician and clinical community, because all of healthcare starts with meaningful, productive, proactive, trustful conversations between the patient and the provider, between the patient's family system and the provider's clinical integrated care team. And I think that what the Alzheimer's Association in our community has been doing, which is so very important, is really reaching the community and the clinicians to talk about how important it is to talk about social and emotional well-being. At the risk of making my answer a bit too long, let me confess that as an African American male, I know how much work I have to put into being fully present, yes, and being fully trusting in each of my clinical encounters. Yes. And as I near the age of 60, how very important it is that I'm talking with those folks God has placed in my life to be my doctors, my nurses, and my clinical experts. How important it is that I talk with them about how, as the old gospel song says, my steps are getting slower. Mm-hmm. And how I can share the experience of aging with a care team that can proactively support me. I come from a family in which Alzheimer's and dementia, sadly, is not uncommon. And it's tough to talk about. And it's tough to talk about for those of us who are younger, watching elders, watching my mom with her aunts and her uncles and her own mother, because of the fact that we think of these elders with the reverence and regard to which they're due.
Yes.
And when the effects of aging begin to kick in, if there's not an ability for us as families to talk about it, to take some of the burden off of elders so that they have more bandwidth in order to age gracefully, and how very tough it is for us to talk to elders about the importance of the airplane safety rule. That rule where the stewardess says, if the oxygen masks have to come down, put your own mask on first and then care for the ones with whom you're traveling.
Yes. Yes. I wanted to share a couple of statistics that I saw regarding African Americans. So it says that 26.8% of Black individuals received an early diagnosis compared to 36.1% of whites. Also, delusions and hallucinations were 2 times as high in Black people with dementia. And there's a 64.9% lower chance of Black individuals receiving a dementia diagnosis at their first visit. And we know that the need to receive a timely diagnosis is necessary to receive optimal care. And when I read about the hallucinations and the aggressive behavior, it just made me think of all those older African Americans that are being seen by the physicians and looked at as being combative, not just working with them the way that they would want them to work with them. And it ties in. It ties in.
It absolutely does. And because of the role that elders play in our community, it's very important, and we revere as African Americans. I have great reverence for feisty folk. I have reverence for folk, particularly because they were born in the days of Jim Crow. And in their entire lives, they have been combating systems of power. It is, in many ways, incredibly important that the Alzheimer's Association is engaged in the community partnerships that it enjoys, because having this conversation in the church, having this conversation at the neighborhood centers, seeding for this conversation to take place around dinner tables is critical. Because what we are understanding when we hear data around late entry into care is how important it is that we're having the conversations now, and that family systems push in to healthcare. Yes. Everybody ought to find the point this year where if there is an elder, why doesn't somebody make the visit along with that elder? Instead of just making sure we arrange for transportation and drop them off, talking with each other to say, is this a visit that I should come into? My medical care team knows when Wade shows up for a doctor's appointment and his wife Lisa is with him, it's because something important has to be talked about. And I find it's much easier for me when I have a relative, a family member with me at the doctor's appointment. So in case I miss questions, there's somebody there that can ask them. When I get answers, there's another set of ears there. It is absolutely appropriate for our elders to say to their doc, I'm going to be bringing somebody with me to my next appointment. And we need to encourage, because these are difficult conversations.
Yes.
No one, least of all me, no one likes to admit that with each passing year, we come closer to our limitations. But it's why the 4 most powerful words of love are, I need your help.
Yes.
And if we can find the opportunity to just express love by asking for help, I absolutely believe the power of community can make up for the economic access barriers that exist in the world of healthcare, because those co-payments, that's dinner and lunch and breakfast today and tomorrow. So we have got to compensate for those defects in the system by tapping into the amazing power of love and the tradition that has always been at the heart of African America.
Yes.
That we lift while we climb. And there is no reason why, as we climb, we are not extending a hand to have a special focus to help our community combat what is a terribly inhumane health disparity, a thing that takes away sharing memories.
Yes. So important, so important. The last video that we did, we spoke with Jackie Dozier from Common Ground, and she talked about being an advocate for her mom. And basically that is what has assisted her mom in being able to stay in her home and not in a nursing home environment. So, you know, we do have to be advocates for each other. You see a mother at the church and she's struggling with remembering anything, you ask her, Mother, do you need some help? I have some free time. Do you want me to go to the doctor with you to see what's going on? You know, be that advocate for that loved one, and also just someone in the community that may need it, because so many seniors do get taken out of their homes and placed in nursing homes because they can't find any other type of assistance. So what you just said is definitely so important to understand.
And Cynthia, I thank you for that response, because I am a huge admirer of Jackie Dozier and the way in which she is very honest and open in her testimony of this stage in her mother's life. And as a result, it makes it very easy for me as an employer to make sure that we're being supportive of caregivers. I think workplaces really want to support their employees, and they're really present when the employee is ill or when an employee's child is ill. We've got a lot of work to do, but we can feel good at where we are in that aspect of workplace policy.
Yes.
But we still have a long way to go when the person to whom the employee is giving care is not a 6-year-older,
Yes,
but an 86-year-older. And as a result, I really would encourage those of us who are actively caregivers for adult members in our family to find the courage to testify about it a little more.
yes.
To share the experience a little more. You never know who it is you might inspire, whose heart might be on the verge of breaking, that your story might embolden. If we can simply share that aging is something we all are going to do.
Yes.
Ageism is that one ism to which we are all going to be subject, as my friend Anne Marie Cook of Lifespan says. And as a result, all of us have to think about what is our risk factor for experiencing Alzheimer's or dementia or some other type of debilitating health condition, and understand and value our Alzheimer's Association for helping us learn how to have these difficult, courageous, but also necessary conversations within our families. I'm at work right now, literally, with an advisor thinking about what are our long-term life plans. As my wife and I both approach 60, as we both have to consider, what does retirement look like? What does long-term care look like? How do we have these conversations with our son and daughter so that they will be prepared at that moment where we might need them to move into decision-making for us? How might we make that easier? How might we make that less painful? And what are the memories that we can implant now so that if my children are in that position, they can do so thinking of all of the wonderful moments of life we've had together without, as I had to do with my grandmother, without being challenged by how with dementia, she was not the same person. And that taught me why I left at the chance to this, is that we need to value, we need to cherish, and we need to hold on to each other and every moment that we possibly can, because literally, as I was taught growing up in the church, tomorrow is not promised to any of us.
I'm so glad you brought that up as far as speaking to your children. What suggestions do you have with starting those type of conversations with your children? I know I've tried to have those type of conversations with my son. He totally shuts down and Mom, you're good. We don't have to talk about that. Do you have any suggestions as to how to start those conversations?
I because I am African American, I start those conversations really centered in what is the African American faith tradition. We know it as Yoruba, but this idea of our elders are always with us as long as we remember them. It doesn't take them remembering us. We're the ones who usher them into our lives by our memories of them. And as long as we remember them, they remain with us. And so I start the conversation, I start all conversations with memories of love, of what are things that we share. Why are they valuable? They're valuable because we care for each other. And that opens the door for how we provide care for folks when they are young and they can't care for themselves. And it allows my mama to still say at 82, I knew you before you knew yourself. And that's important for us to say to young people. But then explain that at the other end of life, there's the opportunity for all of that care to be returned. And I used to think that it was so important when I came home and said to my son, I love you, to have him say, I love you too. When I came home and said hello, to have him say, hello, Dad. until I parented a child with cerebral palsy, a daughter that we no longer have with us. And I discovered I really didn't need her to say, I love you back. I just needed to say, I love you to her. And that was enough. I didn't need her to hug me because she was a quadriplegic. She couldn't hug me. But the fact that she was there,
Yes.
it was enough.
Yes.
And that's how I talk to my children about the dementia that my mom's aunts and uncles, who I call aunt, uncle, how it is that their journey on this earth still had meaning and value, because my ability to just walk in and say hello, to hug them, gave meaning not just to our relationship, but to their being there every visit. I think it's understanding it's one of the few R&B songs that I think is a bad advice. Love isn't a two-way street. That's about love relationship,
Yes.
boyfriend and girlfriend. But love is absolutely a one-way street, because it's what I choose to do. And I think if we talk about the care and the prevention efforts as acts of love, the conversation becomes a lot easier to have.
Yes.
Because quite honestly, it's the good news we learned during the pandemic, when we were stripped of all of so much, when we had limited opportunities to interact except through media like this.
Yes.
What we learned is that which persists and that which strengthens us, and it's love.
Yes.
And I am really hopeful that as we build the next normal, because I refuse to let us go back to what was normal, because that normal had all of these health inequities that we've been talking about, all of these socioeconomic inequities were in that old normal. We don't want to go back there. We want to go to someplace better than that.
Yes. Yes, we do.
And our rocket fuel for getting there, our essential building blocks for building that new normal, and the glue that will hold those blocks together, all the same.
Yes.
Love.
Yes.
And how it is that we love each other, how it is that we love especially the most vulnerable among us.
Yes. And I'm so glad that you brought up love, because when we spoke with Jackie, that was one thing I said to her when she talked about her care, her mom's care and all of that her mother still feels the love. Just like your
Amen.
daughter, she felt the love.
Amen.
She may not have been able to say it, but she felt
Amen.
the love. And that is so important in every aspect of our lives, feeling that we are loved and also loving people, each other. So
amen, Cynthia.
I'm glad you
You
brought that
are
up.
exactly correct, my dear friend. And if there is any clinician who watches this video, I hope that they will understand just how incredibly powerful love is. And when I visit my caregivers, to know in those moments, somebody loves me, somebody's focused on me. Not me, the CEO, not me, the public figure, not even me, the dad and husband, but me as the unique gift given to this planet is so incredibly wonderful. And it's what makes me accountable for doing all the things that the doctors ask me to do when they're not around. It's because of the fact that I know I'm being asked to not eat that thing
Yes.
by somebody who loves me.
Mhm.
And that makes it not a punishment, but really part of service. And I think we are being confronted as our population ages and as the number of elders swell, thanks to gray-haired, gray-bearded Wade Norwood, we have the chance to redefine what aging looks like, to redefine what memory care can look like, and to really ensure that just as we grow up with dignity, that we will be able to say ours is a community where folks can age with dignity.
Yes, yes, definitely. Definitely. So I already know the answer to this question, but I want to ask it anyway. Do you think that African Americans' fear of discrimination play a part in seeking medical care?
Absolutely. And the data proves it.
Yes.
That we as human beings tend to operate with candor and transparency in places and spaces where we feel safe. And we do not do a very good job of thinking about the design of healthcare delivery with this feeling of safety. And I appreciate the fact that in our community, the medical community has recognized this is not something they're good at. And they have been building over the last 10 years, meaningful partnerships with community to say, you are better at creating the places and spaces where people feel safe. How, instead of having the Muhammad come to the mountain, how do we move the mountain out where the community truly is? And so, I'm too busy for idle flattery or false modesty. So I have to say, Cynthia, the incredible work that you helped Common Ground Health do a decade ago to help build such spaces in faith communities, in barbershops, in beauty salons. We take it for granted now. But the Alzheimer's Association was one of the first groups really taking up residency in African American church communities to say, we want to partner. And we know we can't have these conversations in many places, but we know we can have it within the bosom of the mother church of the Black community. And it pointed the way, as it continues to point the way today, that the only way we're going to get over the things that result when you have 14% of the population as African American and only 6% of the doctors as African American. That we have to solve that problem. We have to support the pipeline to deliver more health professionals of color who have language skills across these different communities. That's got to happen. But since that's a long time to grow and starts with kindergartners, and we have to nurture them through graduate school and residency, what we can do in the meantime is tap into the places and spaces where those conversations are taking place, where trust relationships do exist, where there are people who are so rich with social capital that they're able to come and whack me upside the head and say, Wade, you gotta do this for you. Those are the places and spaces where we need to carry this conversation, and we need to say to families, absolutely, we understand. Family business is family business. And reverence for elders is real. But when it's time where help is needed, where mama or grandmama's health and safety is at risk, we gotta know how to put the bat signal up in the sky and let the superheroes in this community come in and be of help. And I can tell you, as a pastor in this community and as somebody who has lived here for my entire life, the resources that are available to support families, the incredible expertise and the genuine love that's within the staff and volunteers of the Alzheimer's Association, we're blessed.
Yes. Yes, they offer so much educational sessions, support groups. They're here for people that need them. They're here for
Amen.
people that need them.
Amen.
All you have to do is reach out, a 24-hour hotline. Who else really does that, you know? So,
amen.
A lot of times, though, we may not know about those resources, and we stay in our own little home and may not know where to even research for assistance. Jackie shared that also in the last video, that she understands. She's well connected. She knows who to reach out to, but there are other people who have no clue where to go to. And that is what important why the Alzheimer's Association partners with other community agencies and the churches, because then the church can let people know to reach out to the Alzheimer's Association.
And Velvet, I'll let you jump in and grab some of this, but exactly to that point, speaking of Jackie Dozier, the incredible gift she is to this community is her ability in the course of the pandemic to help us recruit and then deploy ambassadors, people who could be out in the community and just answer questions about COVID and answer questions about the vaccine. We need to go out into the highways and into the hedges and compel folk to be aware of and comfortable accessing the health supporting resources that exist in this community. And I'm committed to taking those vaccine ambassadors and making them extenders of groups like the Alzheimer's Association, so that we can continue the work of being in the community, spreading the health message, and to deliver the reinforcements needed to the Alzheimer's Association and to their generous donors and contributors and supporters, to let them know that the investment is not in vain, that it is not missing the mark because of these numbers. These numbers just simply show, by golly, if only we had known how to do this 30 years ago. And thank goodness the Alzheimer's Association is doing it now. And that support is yielding dividends, not just for those folks who are experiencing the need for memory care, not just for their caregivers, but the incredible difference that we're making in the lives of everybody else in that family system, everybody else who's in the circle of love around that elder, to really help send the message as we're doing right now.
Yes.
None of us knows what tomorrow may bring, but it will bring aging. And aging may come with issues of Alzheimer's and/or dementia, but you're not alone. You're part of a community. You're part of a community that cares. And all you need to do is reach out, and you will find the Rochester community will wrap its arms around you.
Yes.
And you will be loved.
Yes. One thing that I can say about the Alzheimer's Association is that they realize, excuse me, that they need people of color to speak to people of color. Hence the reason for Rochester Health Engagement Partnerships, partnership with the Alzheimer's Association. They realize that African Americans want African Americans to speak to them. As you very well know, that's what a lot of things have been based on from
Amen.
10, 15 years ago.
Amen. And as our family has grappled with this issue, side, our faith has been an important part of how we've been able to adjust, respond, and grow. And to speak to my family system in a manner that does not acknowledge the amazing grace of the God we worship,
Yes.
it would leave us cold. It would be less than meaningful. And so the opportunity of making sure that our caregiving teams at the individual level and at the community level are diverse, are reflective of the community we seek to serve, is just the common sense of making sure that our efforts are efficient and effective. And as the makeup of our community changes, as we become more and more of a global community, we need to be aware of the fact that this entire conversation we've had around the African American community as compared to the Euro American community now becomes multifaceted, with lots of different global cultures being here in Rochester. And this is the opportunity for us to just partner more closely with groups like the Alzheimer's Association and open those relationships so that all of our community can know that when they ask for help, that they're not getting help from strangers alone. I think part of it is good because that's how strangers become friends. But part of it is also that the institutions and the networks within their communities are also being informed, being equipped, and building partnerships with the Alzheimer's Association so that this care that is incredibly responsive to me can feel just as responsive to all of my neighbors as it feels to Jackie Dozier.
Yes.
Wade, thank you so much. Before we wrap up, I want to say a few words, and then Cynthia can talk about Rochester Health Engagement Partners. But first and foremost, I want to say thank you to you for coming on. You are a joy to speak with. You are valuable, so valuable to our community, and it is just a pleasure to speak with you today. And thank you so much for your words about the Alzheimer's Association. One of the things that I wanted to do is make sure that our viewers know how to reach us when and if they need our support, because we do offer hundreds of free programs. Everything we do is free. We offer the support groups, the care consultations. We can connect you with so many different resources. And all you have to do is call our helpline 24/7. We have a person ready to talk to you. It's 1-800-272-3900. And you can visit us at alz.org/Rochester NY. And I do want to mention one other thing, and it's something that we're pretty excited about. On April 27th, we're holding our 11th annual African American Health Symposium. And that is going to be a full day free opportunity for individuals with dementia and or their caregivers. It's going to be at Anon Baptist Church on Genesee Street. Runs from 10 till 3, if I'm not mistaken. We've got speakers, we've got boxed lunches, we've got networking opportunities, all sorts of things. You can find more information at our website, alz.org/RochesterNY. Cynthia, I'll hand it over to you now.
Okay, thank you very much, Velvet. So the Rochester Health Engagement Partners was formed in 2007 by 4 African-American women who worked in the healthcare field. We would do presentations at various organizations, and we always heard from the African-American participants that they wanted to hear from African-Americans because we looked like them. So we're talking several years ago where there weren't that many African-American speakers. So we formed we operated different seminars. We partnered with the Common Ground Health to do the African-American high blood pressure contest and other things. So I'm glad that I have the opportunity to sit with Wade again and talk about healthcare disparities, because he's been in this a long time and he is a very valuable member to our community. So in order to contact me, you can contact me via www.rhepartners.org. I also have a YouTube channel, Rochester Health Engagement Partners, and I have an email address at healthengagementpartners@gmail.com. So in closing, Wade, what is your call to action for us as the community as a whole to change the outcomes of the disparities that you talked about today?
I would say, first of all, if anyone has not read the Color of Health report, the overloaded report on the nexus of health and poverty, please go to the Common Ground Health website, commongroundhealth.org, and get the facts, because the facts will help inform the argument about the need to transform from a system that focuses on sick care to a system that focuses on prevention and on helping kids grow healthy and stay on track. After being informed, I would say that supporting efforts to address individual or systemic racism is critical. We cannot get health equity achieved faster if we do not attack inequity in the other areas of our community. And I am really, really proud of how the city of Anthony and Douglas is claiming its heritage and really working on becoming an anti-racist community. And then lastly, I would say in this regard, talk to your elders. Make sure that they are connected to healthcare and that they understand their own health self-management plan. And since the worst time to make a friend is when you need one, I would say to everybody, reach out to the Alzheimer's Association and just say hello and ask how you might be able to help. And I think if we do those things, what we are doing is helping to usher in the day where we will gift our children a world without Alzheimer's disease and without other forms of dementia.
Thank you. Thank you. We'd also like to thank our viewers for tuning in today to our conversation with Wade Norwood from Common Ground, talking about healthcare disparities related to Alzheimer's disease and other dementias. Take care and be safe.